Hello, welcome to my YouTube stage. Today in this video, I will be talking about constipation in children. Constipation is a very common problem among children. Usually, parents come to me and ask, Doctor, why my child is suffering from constipation? Constipation usually occurs in the toddler and the preschool age group. As a parent, it is very important for us to understand what are the causes of constipation and what is the real mechanism of constipation. If we understand the real mechanism, the real pathogenesis of constipation, then only we can help our children to heal themselves and to get relief of constipation. First of all, let us know what is constipation. Basically, it is a difficulty and delay in passing stool, resulting in significant distress and lasting for more than 2 to 4 weeks. So the symptoms should be more than 2 to 4 weeks and it should cause significant distress. As you can see here, the child is suffering from lot of distress, lot of pain. Child does not want to go to the toilet, doesn't want to do the stooling, and the child is really suffering. And as a parent, I can understand, I can totally empathize with you. Usually these children are between the toddler age group or the preschool. The history is, say suppose a 3-year-old boy suffering from constipation for long duration. So usually what happens, constipation lasts for long duration, say for 1 year. Next, the parents will tell me that the stool is very hard and it is often pallet-like. Okay, so you must be knowing, but it is very hard and small like pellets. And third point, the parents say to me, the child is very much fear of defecation. उसको बहुत ज्यादा डर लगता है, जब भी उसको पॉटी लगता है वो बहुत ज्यादा डर जाता है, वो रोने लगता है और एक साइड में जाके खड़ा हो जाता है, मतलब बैठना नहीं चाहता है टॉयलेट में. वेरी कॉमन symptom that they come with this history. So fear of defecation or fear of sitting for passing stool. So as we know, to have a proper bowel movement, the child should sit. If we don't sit, if we remain standing position, we cannot defecate. So it is very important. Many of the parents have a misconception or they mistake that the child is trying to pass the stool, or the by standing the child is straining to pass the stool, but this is not the case. This is a withholding behavior. The child is trying to cross the legs and put pressure so that the bowel is moved up. So the child is not trying to pass the stool. Actually, the child is withholding the stool. So this is called as withholding behavior. So this is very important to understand. So what common problems the parents will come with? Number one, the child will be preschooler or toddler and history will be long. The stool will be very hard and child will show fear of defecation and withholding behavior in the form of running, going to a corner, standing up, crossing the legs, etc. Sometimes there may be history of fecal swelling, and sometimes if we dig into, we will come to know that they have already visited many doctors. Many doctors have prescribed many medicine, but there is no relief. So ऐसा ही होता है. जो बच्चा कम उम्र का होता है, जैसे 3 साल 4 साल, उसका बहुत ज्यादा हार्ड स्टूल है और वो मतलब पॉटी के लिए बैठना नहीं चाह रहा है, उसको फीकल सॉइलिंग हो रहा है, थोड़ा सा निकल जा रहा है साइड से पानी जैसा, और बहुत सारे डॉक्टर्स को आप लोग विजिट कर चुके हैं लेकिन कोई भी फायदा नहीं मिला. टिपिकली इस तरह का हिस्ट्री लेके आता है. तो नेक्स्ट फेज में हम लोग जानेंगे कि ये क्यों होता है और व्हाट इज द पैथोजेनेसिस. उससे पहले हमको जानना पड़ेगा कि जो कॉन्स्टिपेशन है, व्हाट आर द डिफरेंट टाइप्स ऑफ कॉन्स्टिपेशन. देयर आर मेनली 2 टाइप्स ऑफ कॉन्स्टिपेशन. One is called as functional constipation and one is called as organic constipation. When there is some problem in the child's body, maybe the problem is in the GI tract, or the problem is in the blood like hypothyroidism, or there are some behavioral problems. In that case, we call the constipation is organic in origin. That means there is some problem in the child's body which can be detected by doing some investigations. But 90 to 95% of the cases, it is seen there is no problem in the child's body. So if we do investigation, you will find everything is normal. Your child's hemoglobins will be normal, your child's growth will be normal, there will be no problem with the thyroid hormones, then there will be no problem with the GI tract, anal canal will be normal, everything will be normal, but the child will be having constipation for a long duration, say 6 months, 1 year. So that part is divided into the functional constipation. So that is called functional constipation. So in my today's talk, we will mainly discuss with the functional constipation. What is the mechanism of functional constipation? Because देखिए 100 में से 90 से 95 बच्चे को तो फंक्शनल कॉन्स्टिपेशन ही है. तो एज ए पेरेंट हमको मालूम मतलब होना चाहिए कि जो फंक्शनल कॉन्स्टिपेशन है जिसमें कोई भी प्रॉब्लम नहीं है अंदर में, क्यों हो रहा है और इसको कैसे हम लोग ट्रीटमेंट कर सकते हैं. सो इफ यू लाइक दिस वीडियो टिल नाउ, अगर अभी तक आप लोगों को ये इंफॉर्मेशन अच्छा लगा है और ये वैल्यूएबल लग रहा है, तो प्लीज लाइक दिस वीडियो एंड शेयर विथ एज मेनी पेरेंट्स एज पॉसिबल, बिकॉज दिस इज ए वेरी common problem. Almost 30% of the children are suffering from constipation. So before we dive in, let us see what is the common cause of constipation. Usually the parents bring with a long history for say 6 months, 1 year, but the onset is always acute. That means the origin of the constipation is always acute, means there is something happened in the past which piled up and result in constipation for a long duration. This may be a minor illness like a viral fever, and the child was ill, the child was not passing stool for 2-3 days, and that thing become more and more and more, and later developed into a chronic constipation. Or maybe due to the illness the child was on some drugs, say the child was on some antidepressant due to some behavioral problems, or the child was on iron therapy. So some medications also may start the constipation. Or maybe there may be some dietary factors, like the child is not taking proper fiber in the diet, the child is not taking proper fluid, what is required for having a good bowel movement. So those may be the reasons. Third reason may be the child was not properly toilet trained. So this is a thing. So how to toilet train the child? So I will discuss in detail about this. So toilet training is very important. If you don't properly train your children, then what will happen? The child may develop constipation. Many a times it is seen then where when the child go to for a traveling, then the child may develop constipation because maybe due to the change in the place or change in the potty, the child is not liking to go to that potty, so the child is holding the stool and later on develop more and more constipation. Or sometimes maybe the school environment is not so feasible for the child to have the regular bowel movement, the school latrine may be not clean and the child does not want to go there and maybe holding, so that may lead to constipation. So whatever may be the reason, it usually start as acute and later on become chronic. What is the pathogenesis of functional constipation? So this is the most important part which I am emphasizing on, and as a parent it is very important for us to understand the pathogenesis of constipation. So the pathogenesis can be divided into 5 parts. The number 1 is painful bowel movement. So what happened, due to some acute reasons, the child developed constipation that piled up. Now the child had painful bowel movement. For this painful movement, the child does not want to go to the toilet and the child is withholding the stool. So the next point is voluntary withholding of stool. So what will happen next? Stool will be accumulated in the rectum. So this is known as fecal stasis. And when the stool is accumulated in the rectum, our rectum will draw all the fluid from the stool and the stool will become large and hard. So if I draw it like this, let me draw it. So we know, so say suppose this is the abdomen of the child. So in the abdomen we have intestine, large intestines and small intestines are there. So lots of intestines are there. So this large intestine ends up into rectum and ultimately become the anal canal where the stools are passed. Now, if the child develop constipation due to painful bowel movement and voluntary withholding for many days, what will happen? The stool will gradually accumulate in the rectum. When the stools will accumulate in the rectum, what will happen? So this is the rectum. So I will draw it here. So now the rectum will become capacious or large, and the stool will become hard due to absorption of water, and it will become like an obstruction. Now the rectum has become like a bag. The elasticity of the rectum is decreased. So this result in two problems. Number one, elasticity is decreased. So the capacity of the rectum to push the stool out has decreased. Secondly, the urge to defecate, because there are many nerve endings in the rectum. Now, as the rectum is capacious and the elasticity is lost, so its urge is also decreased. The child does not feel the urge to defecate. So what happened? Due to fecal stasis, the child will develop more and more painful defecation and more withholding behavior, and it will become a habitual constipator. Okay, so as a parent or as a caretaker, we should know or we should understand the concept of mega rectum. Okay, the fifth point, the terminal point of constipation. The rectum habituates to accommodate large fecal mass, and the urge to defecate also decreases. So what happened? In the rectal wall, there are smooth muscles. So what is the function of these smooth muscles? The function of these smooth muscles is to contract and push the stool out. But now, as the rectum has become capacious, the smooth muscles will become also stressed, and their capacity to peristalsis or capacity to push the stool out has decreased. As a result, this stool will accumulate and the child will not be able to pass it. So whatever you do, the child will have this problem of constipation. So what is the remedy? So this condition is known as fecal impaction. So we have to disinfect, or we have to do disimpaction of the fecal lead or fecal mass, hard mass. Then only the child will have a safe passage and the child will able to pass the stool. So after understanding the pathogenesis, now we will come to the management. So the management of constipation is actually four-pronged. First is education. As a parent and caregiver, we have to know what is the mechanism of constipation, what is the reason of constipation, what is going inside the child's rectum. Then only we can understand what to do. Next is disimpaction. So if we don't disimpact this large mass of fecalith, the child will never be able to pass stool easily. After disimpaction, these smooth muscles will take at least 3 to 6 months to regain its capacity to have this peristalsis. So we have to keep this passage smooth for at least 3 to 6 months. For that, we have to give maintenance therapy. So first is education, second is disimpaction, and third is maintenance. Maintenance means you have to give a laxative, a medicine which will keep the stool soft, and there will be there is no need for any urge or no need of any peristalsis to happen, and it is easily passed by the children. When these three things will be made, like you have understood what is the problem, the doctor has done the disimpaction, and now your child is on maintenance therapy along with proper diet, then what is happening? Now your child is having easy bowel movement and your child's rectum is free there is no need for any peristalsis, no need for any urge. Because of the softness of the stool, it is easily passing. Though now your child's fear of defecation will decrease. Previously your child was very much afraid of going to the toilet. He was standing, he was crossing his leg. But now, as we are doing maintenance therapy with some laxative, now the bowel movements will be easy, so your child will not feel that pain, and he will or she will easy go to the toilet. Now our aim in this maintenance phase is to teach the toilet training, how to do the toilet, and next is to take care of the diet, and lastly follow up. So if your child is having constipation from 6 months, 1 year, then it is very important to do a proper follow up. So you have to go to the doctor frequently. You have to go first initially every 1 week, then after 2 weeks, then after 1 month. So like that you have to keep going and take the medications, and the proper the toilet training should be also good, and diet should be also good. Many parents have some questions like, if we give a maintenance therapy or laxative for a long duration, is it addictive? So my answer to this question is no. So laxatives are not addictive, because laxatives, the mechanism of action is what? The laxative will just do the softening of the stool. It acts in the lumen of the rectum, so it is not absorbed and cause some side effect or addiction in your child. So before going to that, you should do a proper toilet training of your child. So what is how to do that toilet training, or how to do that behavioral modification? You have to do routine toilet sitting at least 2 times in a day for 5 to 10 minutes after meals. So when we do that, we utilize the gastrocolic reflex, which normally happens in children. So children have that gastrocolic reflex, that after eating, the child usually have an urge to defecate. So we take advantage of that situation, and we, in the morning, like after doing brush and breakfast, we can ask the child to sit for 5 to 10 minutes, whether he or she is feeling to urge to defecate or not. But we have to make them sit for 5 to 10 minutes in the morning and in the evening. So assess the readiness of the child. Next point is get the right type of equipment. So the potty should be good one, the child should be liking that. Then create a routine and develop a regular habit. So, and demonstrate the posture also, and maintain a stool diary. Okay, so stool diary is very important. And when you do all this behavioral modification, always remember, don't punish your child, but you use positive reinforcement. In an earlier video, in another video, you can go to my previous videos, I have discussed about positive reinforcement. I have discussed many methods by which you can do positive reinforcement by encouraging your child, but unfortunately the audio of that video is not so good, so I will be requesting you to put your headphone to listen to this video. The video content is good, but due to some technical problem, the audio was not good, so sorry for that, but that is also very important. I will give the link in the description below. So this is the thing. So you have to assess the readiness of the child, then get the right type of equipment, create a routine, demonstration, do not scold the child in case of incident of soiling, and encourage the habit, do positive reinforcement. And lastly, most important thing is diet. So the child's diet should have plenty of fluids and water. You should restrict milk intake as much as possible, and high fiber diet in the form of green leafy vegetables and fruit should be there. And what is the requirement of fiber requirement in your children? You can calculate this. There is a formula I am sharing with you. Dietary fiber is equal to age of your child plus 5. Suppose your child age is 3, then the 8 gram of dietary fiber should be there in a day. If your child is say 6 years, then 11 gram per day should be the fiber content. So I will show you few pictures. You can have an idea how much fiber content in each of these items. So in this picture you can see then suppose common fruits like banana, apple, strawberry, all these have good amount of fibers. So if you take a small fruit of 100 gram, it contains 2 to 3 gram of fibers. And if you take a large fruit like a large pomegranate or a large apple, a large orange, it contains 200 is the size is 200 gram, that it contains 4 to 6 gram of fiber. Similarly, tuberous vegetables, tubers like carrot, cucumber, etc. If it is 100 gram, it has double the amount, that around 4 to 6 grams of fibers in that. So you can give that, or you can give green leafy vegetables. 50 gram of green leafy vegetables has 4 gram of dietary fiber. So dietary fibers is very important. So basically, this is the main thing. So the take-home message of this video is that education and behavioral modification and diet, these three things are very important. We have to identify the fecal impaction, and as early as possible, we have to do the disinfection and then put the child on maintenance laxative therapy. So there are many laxatives are there in the market. So most commonly used laxative is polyethylene glycol, which I commonly use, and it is very effective. Then adequate dose and sufficient duration of the laxative is the key to success of the treatment. And lastly, if there is any organic causes, if there is any such signs or symptoms which is suggesting of some organic causes, then we have to evaluate the child. Tips. So before finishing, I will share two lists. One is your foods acting as natural laxative. So you can give this. Okay, one is pineapple, another is ripe banana. My handwriting is not so good, so please pardon. Dates, very good laxative, natural laxative, and pomegranate seeds. So you can give this to your child. So if you're liking this video, again I'm emphasizing it, please share with more parents. Maybe many children are suffering from constipation. They should understand the pathogenesis, what diet should be given, what are the various types of common items which increases the fiber in the stool and help in having the motions. So it is a very important video. Share with your friends, colleagues, and everyone must be benefited from this. And also another thing is that if you share this, I will also feel motivated to prepare more such educational videos. So in the upcoming I will be taking more and more videos in this form, in audio visual learning for parents, especially for parents which have children of all age group. I will talk about newborns and other behavioral problems, autism, ADHD, everything, all the topics will be covered. Just I need your support. So please, if you have not subscribed till now, please subscribe this channel, and I will be very happy if you subscribe me. And also, if you are liking it, if you have get little bit of benefit from this video till now, and if you are still watching, please like this video. So next chart is, what are the constipating foods? So avoid dairy products, chocolates, avoid bakery products like biscuit, breads, and avoid junk food. So what are the junk foods? Chips, kurkure, Maggi, burgers, pizza, all should be avoided. So, and you should have a lots of fluid intake. Fluid intake should be very much important. So basically this is the video, and thank you for watching till now. And in the next video we will discuss something more. Notes are also very important for parents. So whatever I have written, you can note it down, because if you just consume this information, you will forget. So if you forget, you can take a screenshot of this also, keep a screenshot and share with other people. And this is not for only children. If you're adult also, this lesson will be helpful to for adults also. So what diet you should have, how much fruits you should take, how much tubers you should take, how much vegetables you have to take, what is the laxative therapy, how much duration you have to take. So laxatives are not does not cause addiction. All these important points in this video. And if you don't have those knowledge till now, if you have come to know something, then it will be also very good for me to know that if I am been able to help someone with my little bit of knowledge, whatever I have. Please subscribe the channel. Thank you so much.